Welcome to Health Unplugged, our superstars. Today's conversation is about a health issue that has become incredibly common, yet not many people know how to deal with it. There is a growing connection between obesity and diabetes, often referred to as diabesity. What is worrying today is it's not just affecting the older generation, but there are increasing cases of weight gain, blood sugar imbalances, fatigue, and metabolic issues even with younger generation at an early age. So to understand this and to determine what gets affected and how what people need to know about before it becomes a serious concern. Today we are joined by Dr. Soumya Poduval, who is a consulting physician, diabetologist, intensivist, and a co-founder of Symphony Healthcare. So welcome to our show, Doctor.
Yeah,
We are
thank you.
delighted to have you.
Thank you for having me here.
So, Doctor, first of all, let's understand the term diabetes.
So, diabesity is a medical term combining diabetes with obesity. By diabetes, we mean type 2 diabetes mellitus. The pathophysiology of type 1 diabetes mellitus and other forms are quite different.
Okay.
So, here, when we mean diabetes, it is type 2 diabetes.
Okay. So, Doctor, why obesity and diabetes are so closely linked?
So obesity is basically excess body fat, right? So what happens is in an obese individual, this excess body fat leads to chronic inflammation and
Okay.
it causes insulin resistance, which leads to diabetes mellitus,
Okay.
type 2 diabetes mellitus. So obesity and diabetes are very strongly linked and it is important to treat both. Just treating one is not going to be enough.
So, when we're talking about diabetes and obesity, people often think that diabetes is only about eating a lot of sugar. So, is this a oversimplification of the term?
So sugary foodstuffs and also foods high in calories, they cause rapid glucose spikes in the blood.
Okay.
So they both are harmful. So nowadays we see a lot of people having highly processed foods and sugary foods, sugary drinks. So all these foodstuffs are harmful as they cause a rapid spike in blood glucose levels.
So, do you think is diabetes becoming one of the global health concern today? What do you think about that?
Yes, definitely it is. So it is projected that by 2050, 1 in 8 adults are going to live with diabetes, and
Okay.
many of them are also obese.
Okay. So, it's a
Yeah,
serious health
yeah,
concern
it
that
is.
we need to
It is
tackle.
very concerning, and we need to address it, and we need to find a solution to it.
Correct. So when we are talking about a younger generation that today they think that they are more prone to diabetes or diabetes and obesity. So do you really agree to that concept?
Yes, definitely. We are seeing more of obese children and pre-diabetics in the younger adult
Okay.
age group. It is because of the sedentary lifestyle, the food choices. They eat a lot of highly processed food, high calorie foods, and they are moving less. There's less physical activity.
Correct.
They are glued to the screens. So all these factors are responsible for the growing number of cases in young adults.
Since we are talking about the detection, are patients being detected early at an early stage compared to before?
Yes, definitely people are more aware now, but we see mostly people about the age of 40 who are going for yearly health checkups.
Correct.
Now it is recommended that everyone above the age of 30 should go undergo yearly health checkups, and even those in their 20s, if they have a family history or certain risk factors, they also need to get themselves tested.
We just heard that early detection and yearly health checkups are a very important part of early detection. So on One Health Assist platform, we have a lab panel where you can get tested on a annual basis, or you can choose your packages as per your health requirement. So you can book your health lab test today on One Health Assist panel. So nowadays we see a lot of cases, doctor, that people are working late at night and they are just ordering food online or eating junk food at very late hours. So, how does a lifestyle related thing affect in terms of diabetes?
Yeah, so late night snacking, having large meals at night time, all these are, they worsen the metabolic health.
Okay.
So the body's insulin sensitivity is highest during the daytime and it declines by evening.
Okay.
So a heavy meal should always be eaten during the daytime, and you should always have a light meal at night time.
So, doctor, do many people realize that they are metabolically unhealthy before even the diagnosis happens?
Not many people are aware.
Okay.
So unless they get an abnormal lab report or they develop some health complications, that is the time they visit the doctor or
Hmm.
get themselves evaluated. So yeah, again, as I said earlier, screening, getting yourself tested is very important.
Okay. So, are there any warning signs that people commonly ignore, doctor?
Yes, there are certain signs and symptoms of insulin resistance, like persistent fatigue, increased sugar craving, uh, darkened patches over the skin.
Okay.
So these are some of the signs and symptoms which can people can have during the insulin resistant phase. So if they diagnose early, they can prevent themselves from progressing to diabetes.
Okay. So, the early detection is very
Yeah,
important
yeah.
here. So, let's go to the next segment and try to find out what are the early signs that people usually miss out on. So, let's get started on what are the different symptoms or signs that a patient or a individual should watch out for.
Yes, so as I said earlier, also insulin resistance has certain signs and symptoms. May not be present in everyone, but definitely if they are present, you should get yourself evaluated. So acanthosis nigricans is one such sign, that is darkened skin patches. They occur mainly in the skin folds and around the neck region.
Okay.
Along with that, increased sugar craving, persistent fatigue, tiredness. So, if you have any of these signs or symptoms, you definitely should visit your doctor and get yourself evaluated.
Okay. Let's move to the next question. Can someone look externally normal and still be addressed or evaluated?
Yes, there is a term called as lean diabetes or
Okay.
thin skinny diabetes. It occurs in individuals with type 2 diabetes mellitus, where they are externally thin, like they might have a normal or even a low BMI,
Okay.
but they have a higher visceral fat to muscle mass ratio. So they
Okay.
are at more risk of developing health complications like diabetes mellitus, high blood pressure, high cholesterol levels, cardiovascular diseases. So typically in Indians, we Indians are more prone to this having lean diabetes. That is, we look appear thin. We have a normal BMI, but we have more visceral fat. Visceral
Okay.
fat means fat surrounding the
Abdomen.
internal organs, mainly in the abdomen region.
So, how one will come to know even if the obesity is not handled, especially for the lean people,
Yeah.
what are the main signs that they should look out for?
So yeah, so one way is to do the lab test, do
Okay.
their fasting blood sugar levels,
Hmm.
post lunch blood sugar levels, HbA1cs.
Hmm.
That will help them guiding further if they are, they need a
Hmm.
treatment or they are in the pre-diabetes stage
Okay.
and they need to uh, work on their lifestyle.
Okay.
So that is one way they can do it. Other way is by indirect methods. There are certain tests which will help them identify, like fatty liver, if somebody has fat deposition in the
Okay.
liver. So ultrasonography will help in those people.
So even if they externally look okay, but they need to watch out for the internal signs and symptoms.
Yeah, yeah.
Okay.
That is why it's very important for them to screen themselves regularly
Okay.
and do test when as and when needed.
So how important is the abdominal fat specifically when an individual is assessing himself or herself?
So, a large waistline is a component of metabolic syndrome.
Okay.
So, metabolic syndrome are people with who have a larger waistline, and they are more prone to develop cardiovascular diseases, heart diseases, and type 2 diabetes mellitus.
Okay.
So, it's very important. It's a very important component, and we should measure it, check regularly.
Watch out for that
Yeah, yeah.
on a regular basis.
Yes.
Okay. So, doctor, why do you think many patients discover diabetes only during the routine checkup? Is there a
So,
specific reason to that?
So, diabetes does not have overt symptoms. So, sometimes they may be asymptomatic or they may have certain symptoms which they may be ignoring.
Okay.
So, unless they get themselves tested, they may not be aware that they are suffering from the disease.
Okay. So there is nothing specifically important for them to watch out, you know, if
Yeah,
we
there
are
are
not doing the regular blood workup. So how will they, I
So
mean,
there are certain symptoms like increased thirst, polyuria, increased
right.
urination, increased frequency of urination, tiredness. All these are symptoms which can occur, or sometimes they may directly present with the complication of diabetes. So they may
Okay.
have diminution of vision,
Mm-hmm.
kidney disease, or heart disease. If it's if they come later on.
Okay, on a larger
Once,
picture.
yeah,
Okay.
once they develop the complications, so they may present with those symptoms also. But sometimes they may not have very specific symptoms, so they may not be aware of the disease.
Okay. So, do you think fatigue is the most common symptom when we are relating it to diabeticity or diabetes?
So fatigue occurs in many chronic diseases. It's
Correct.
not just the symptom of diabetes, but if it is present, definitely you should visit your doctor and get yourself evaluated, because you don't want to miss out a disease like diabetes.
Okay.
So yeah, so getting yourself evaluated is very important.
Let's move to the next segment. We commonly hear a term insulin resistance very much nowadays, even on the internet. So, let's try to understand what that term means,
Yeah.
doctor.
So, insulin resistance is when the cells in your muscle, fat, and liver do not respond efficiently to the insulin,
Okay.
and they are not able to take up the blood glucose to form energy.
All
So,
right.
there is insulin resistance. The insulin in the bloodstream is not being able to take up by the cells, and which ultimately leads to insulin resistance and high blood sugar levels eventually.
Okay, so that is the reason people who are early detection they have like tiredness or fatigue because they are not getting the enough
Yeah, so
energy
there is not enough
stimulated. Yeah,
energy for the muscles and the other cells to utilize. They are not able to utilize glucose from the bloodstream,
correct.
so they feel tired, they feel de-energetic, and all those symptoms do occur.
Okay. So, doctor, does insulin resistance develop long before even the diabetes is detected?
Yes, it begins with insulin resistance and eventually it progresses to diabetes mellitus. So, what happens is initially when there is insulin resistance, the pancreas secretes more insulin. So, insulin comes from an organ called as pancreas in the body.
Hmm.
So, the pancreas secretes more insulin to overcome the insulin resistance, but
Right.
eventually there is a pancreas is not able to sufficiently produce as much as insulin. So, there is insulin deficiency, which then leads to high blood sugar levels, which is known as hypoglycemia, and it
Correct.
develops as type 2 diabetes mellitus.
Okay. So, doctor, is insulin resistance reversible according to you?
So, yes, initially insulin resistance is reversible through sustained lifestyle changes. So,
Okay.
when you lose weight, you exercise more, it can be reversed.
What usually pushes the body towards the insulin resistance over the time, doctor? Can you
So,
elaborate?
yeah, so the increase in the waist circumference, so the
Hmm.
visceral adiposity, the visceral fat,
Hmm.
is more harmful. It leads to chronic inflammation
Okay.
such that the insulin signaling, the receptors are not able to, take up the glucose from the bloodstream. So, which
Okay.
is known as insulin resistance.
All right.
So, the insulin resistance occurs mainly because of the fat, which leads to chronic inflammation. So, there is certain pathways which work, and because of that, it does leads to insulin resistance.
Okay. So the receptors are not able to catch the
Yes.
signal and
Yeah, and they are
work
not
towards
able.
breaking down the
Yeah,
fat. Okay.
correct, correct. So they are not able to utilize the glucose which is there
Hmm.
in the bloodstream,
Hmm.
and more insulin is secreted by the pancreas because the glucose is not being able to utilize, and
Okay.
eventually there is insulin deficiency, and the patient develops high blood sugar levels
Okay.
and diabetes.
Are people becoming more aware about the metabolic health today, or the awareness is still low or lacking somewhere?
So people are becoming more aware these days. More so in the cities, people are quite aware compared to what they were before. But these diseases are, this generation is facing these problems more. So it will take time for everyone to, make these necessary changes.
So do you think that the awareness still needs to be a little higher in terms of this
Yeah, yeah,
disease?
yeah.
Okay.
We need to make people more aware, and I think with time it should happen.
Okay. So let's move to the next segment and find out how food affects this particular disease. So, doctor, let's find out. Uh, has the modern age eating food habits have changed compared to the previous generation?
Yes, definitely. Modern eating has changed drastically from a culture of home cooked seasonal meal to
Okay.
now a more convenience driven meal.
Okay.
So the diets today prioritize fast and highly palatable and global flavors. So it relies heavily on ultra processed foods and ready to eat foodstuffs, which contain a lot of artificial preservatives, added sugars, and sodium to improve the shelf life of these foodstuffs.
Correct.
So yeah, eating out, takeaways, having fast food, all these things which are all high calorie food stuff, they all lead to a worsening in metabolic health.
Okay. So basically, the processed food are becoming more consumable now
Yes,
compared to the
so
home
because
cooked.
people want everything quickly and
Yeah,
faster, and they
correct.
want to finish their meals also faster. So all these,
On the go types.
yeah.
So, is the issue only related to sugar, or are there other dietary patterns that affect the diabetes?
So yeah, sugary foodstuffs cause rapid glucose spikes in the bloodstream. Also, along with just with sugary foods, which we tend to think they're chocolates or fruit juices, there are also other high-calorie foodstuffs which also cause a rapid spike in blood glucose levels.
Okay.
So all the ultra-processed food and the ready-to-eat food may not be as healthy as we think they are.
Okay.
So yes, so definitely home cooked meal which contains grains, and the traditional Indian meal is
Correct.
more healthy.
So, since we are talking about food habits and lifestyle related impacts, how important are meal timing and food habits here?
Meal timing and food habits are crucial pillars of metabolic health.
Okay.
So as I told you before, having a late heavy meal, nighttime snacking, all these are bad for your metabolic health. uh, Eating right, so eating slowly, chewing thoroughly, and eating the right food will help you long term for having a good metabolic health.
So, do you think that crash diet and quick fix weight loss trends actually affect?
So yes, the crash diets, they will give you faster results. So initial results will be you are losing weight faster, but in the long term they affect your metabolic health and they lead to a lot of eating disorders.
Okay.
So there can be rebound weight gain, nutritional deficiency, muscle loss, and disordered eating.
Okay.
So a good balanced diet, it will help you more than just not eating at all.
Okay, so the quick fix weight trends that we see on internet are just going to help us in a temporary manner. But if
Yeah.
we are looking at a long-term perspective, we should
Yeah.
follow a balanced diet, right?
Definitely. So
Okay,
it is you have to personalize as per the patient
okay.
and his lifestyle.
Hmm.
But definitely just not eating at all and going into nutritional
Hmm.
deficiencies or having rebound weight gain is not going to help in the long run.
Right. Since we just heard from the doctor that maintaining a better lifestyle and following a good diet is a very important aspect when we are dealing with diabetes and obesity, you can log on to One Health Assist website, get your customized diet plan. You can track your calories, you can monitor your water intake, you can set your diet in place and have a healthy lifestyle. We hear a lot of trends nowadays on internet regarding what are the medicines that we use for diabetes are also used for weight loss. So do you think, doctor, as a diabetologist specialist, that these are the correct way of using the medicines?
Yes, so they have health benefits. So we have to see what are the benefits versus the side effects.
Okay.
So they have health benefits like they improve the HbA1c levels and also cause significant weight reduction.
Hmm.
Depending on which medication they are using, there is a good amount of weight loss. There are certain side effects they have to be avoided in people having gallbladder diseases, pancreas disease of the pancreas,
Hmm.
and having history of medullary thyroid cancers,
Okay.
or having family members suffering from medullary thyroid cancer.
Hmm. So there are a lot of long-term side effects which we should be, made aware of before even using those medicines just for the weight loss pattern.
Yeah, so we need to educate the patient about the benefits versus the side effects that can come up. So
Okay.
if a patient is morbidly obese and
Hmm.
having a lot of health problems, health complications, then definitely these medications are going to help them. It depends. So patient selection is very important.
So this is for our viewers. Next time when you see some information or trend on the internet, just don't follow it blindly. Consult a specialist doctor and get your treatment plan customized. Let's try to find out how stress, sleep, and metabolic issues are connected. So, doctor, how do you connect that for our viewer? What are the main things that you?
Yeah, so stress is a major catalyst for a poor metabolic health.
Okay.
So it leads to many diseases like heart diseases, diabetes mellitus, and high blood pressure. So basically, chronic stress leads to consistent cortisol release. So there is
Okay.
a cortisol release which increases insulin resistance, it disrupts metabolism, increases fatty acid levels in the body. So chronic stress, people don't realize, but it is very harmful for your metabolic health.
Okay, so nowadays a lot of information is floating on internet on cortisol. So it is just because of chronic stress that it is getting increased daily in a metabolic health.
Yeah, so there are many different causes of
Okay.
increase in cortisol release. So there are other conditions also which cause them. But stress is also one of them. So chronic stress is harmful for your metabolic health.
Okay. So doctor, does poor sleep directly affect blood sugar and weight gain?
Yes, poor sleep definitely worsens your metabolic health. It dysregulates the hormonal balance. So it increases ghrelin, which makes you feel more hungry. There's a hormone called as ghrelin, which makes you
Okay.
feel more hungry. So it increases that hormone, and it decreases leptin, which makes you feel full.
Okay.
So basically, you tend to eat more, and it worsens your metabolic health.
Okay, so that's why when we don't sleep at the right time in the night, we feel more hungry, and there are a lot
Yeah,
of cravings that happen.
yeah,
So this is the reason for that.
yeah,
Okay.
definitely. There is an emotional eating also, which we will
Yeah,
discuss
it's
later
called
on.
stress eating, I
Yeah,
think so.
yeah.
So, doctor, does emotional health directly affect the eating behavior and metabolism?
Yes, negative emotions like anxiety, stress, or boredom can
Okay.
lead to consumptions of highly palatable, high calorie food stuff. So there is a thing called as emotional eating. So people tend to eat more of calories during that period. So it is directly related, and we need to address that. We
Okay.
need to solve the problem.
So next time when you feel that you are doing stress eating at night, you know what are the symptoms. So get yourself checked. So how much of modern metabolic diseases are connected to lifestyle imbalances? What do you think?
So most of these modern metabolic diseases are due to a poor lifestyle. So they were not, the prevalence was much less before compared to what it is now. So definitely there's a direct relationship with the lifestyle, and yeah, we need to change our lifestyle for the better health.
Metabolically
Better health.
better health. Okay. So doctor, are people taking stress seriously enough in terms of health perspective?
Many people continue to work despite having a quiet burnout.
Okay.
Unless they develop some health complication, then they are forced to take the time off.
Okay.
So, yes, not many people are taking the intense working hours, the long working hours, and the chronic stress very seriously. So, they should.
Let's move to our next segment and find out about the young adults. So, doctor, are you now seeing pre-diabetes and obesity more prevalent in the younger generation?
Yes, definitely. We are seeing more number of children with obesity and young adults with pre-diabetes and also type 2 diabetes mellitus.
Okay.
So the number of people living with obesity in the younger age group is increasing alarmingly, and it's quite concerning.
So, how concerning is the childhood obesity nowadays?
So it is quite concerning because childhood obesity leads to early onset of many metabolic diseases like heart diseases, high blood pressure, high cholesterol levels, even type 2 diabetes mellitus. So the younger age group is also at risk. Earlier it was seen only more so in the age above 40 years of people
Okay.
above the 40
Yeah.
years of age. Now we see a lot of children and young adults facing similar issues. So it's because of the lifestyle and poor eating habits.
So, when it comes to children's long-term health, what are the habits that are more worrying or more concerning for you as a doctor?
So yes, limited physical activity. They are glued to their mobile phones or
Absolutely.
televisions. Limited physical activity, high screen time, having ultra processed foods and high calorie food. Uh, all those things that really are concerning.
So, since we're talking about young generation, do you think that parents usually miss out on the early signs and symptoms?
Yes, sometimes parents do miss out the early signs and symptoms. What I feel is parents can use the guidelines like the 5210 guideline, in
Okay.
which they should have five uh, servings of fruits or vegetables, less than 2 hours of screen time, one plus hour activity, physical activity of 1 hour or more, and zero sugary drinks. That will help their children have a better, healthy
Okay.
lifestyle. They will help behavior. So it's quite important for parents also to understand these things and guide their children correctly.
That was a great insight provided by doctor for the parents of young generation to understand their signs and symptoms for kids and come up with a solution with a doctor. So how important is prevention at an early age?
So yeah, the earlier you start, as we discussed, the insulin resistance can is reversible. Weight loss helps in controlling, curtailing many diseases.
Okay.
So starting at an early age is definitely going to help. Eating the right foodstuffs and exercising and having a good metabolic health will prevent diseases in these individuals.
Okay. When you're talking about a younger generation, prevention is more about alteration of the lifestyle and metabolic
Yeah, yeah.
habits that will definitely help them to.
Yes, yes, definitely. The earlier he starts, right from beginning, the child understands. So
Okay.
it's if we give them the correct advice,
Mhm.
what to eat, and encourage them to do more physical activity, it's definitely going to help in the long run.
So when we are talking about diabetes and obesity related to women, what we would like to know is diabetes affecting women in a different way?
Yes, diabetes is uniquely different for women because of the reproductive, hormonal, and physiological differences, in which women are tend to having more complications than men. So they have more serious complications than men
Okay.
because of a lot of hormonal and different stages of life. Women have different, health problems.
Right. So for mainly because of the physiological
Yeah, there's
changes.
physiological differences in men and women. So women have more chances of developing serious complications. So they need to be more careful.
So how are PCOS and insulin resistance connected, ma'am?
So yeah, so PCOS is now termed as PMOS, that is polyendocrine metabolic ovarian syndrome.
Right.
So insulin resistance is a core driver of PMOS, affecting 70 to 95% of individuals with obesity and PMOS, and 30 to 75% of women
Okay.
with lean PMOS.
Can pregnancy related diabetes become a long term health issue in later life for a woman?
Yes, women with gestational diabetes have more chances of developing type 2 diabetes mellitus later in their life. So
Okay.
they have to have a healthy lifestyle and screen themselves regularly. They should get themselves checked regularly.
So during the pregnancy, they are advised to take the medicines for gestational diabetes. So do they
Yes.
have to continue those, or it's like it has to be determined?
So gestational diabetes mellitus occurs only during pregnancy, certain period of
Hmm?
pregnancy. So, if it continues beyond pregnancy, then we term it as type 2 diabetes
Okay.
mellitus. So, those who don't need medications later on, they still have to get themselves screened because they are at risk of
Oh,
developing type
right.
2 diabetes mellitus later on.
Okay. So screening plays a very important
Yeah,
role
yeah,
here again.
yes.
Okay. So when we are talking about hormonal changes, how does it affect the metabolic health for a woman at a different phases of life or different age?
So, particularly during the perimenopause and menopausal period, women have a declining estrogen levels, which leads to insulin resistance, increasing visceral adiposity, visceral fat increases, and also there is muscle loss if they are not taking care. So yes, so the that age group is more vulnerable to getting cardiovascular diseases, high blood pressure, obesity, and type 2 diabetes mellitus.
Okay, so there is a vast connection between perimenopause, menopause, and the obesity.
Yeah, so it becomes difficult for women in that age group to maintain weight and the muscle mass, and they are tend to develop more complications.
Let's try to determine the types of diabetes. Ma'am, can you explain the most
Yeah,
prevalent
so
one?
So type 1 diabetes mellitus is an autoimmune disease which it occurs when pancreas is not able to produce insulin, and it occurs in the younger age group, in
Okay.
the children. We see it more commonly in children. Type 2 diabetes mellitus is because of insulin resistance, relative pancreas secreting less of insulin eventually, and leading to it has many metabolic risk factors.
Okay.
So it has a different pathophysiology than type 1 diabetes.
Let's talk about the treatment and reversal. So, can diabetes be reversed if it is caught early enough?
So diabetes can be reversed, or to put it correctly, can be put into remission
Remission.
if detected early and through sustained lifestyle changes. So, weight loss, better diet, better, uh, food, the healthy food choices, and more of physical activity can put diabetes into remission if it's in the earlier stage. Once the insulin deficiency occurs, the pancreas is not secreting insulin enough, then we may not be able to, put it into remission. Then we may need the medications. And
Okay. So, are medications alone enough without a behavioral change?
so medications are necessary in individuals who have high blood glucose levels. But along with medications, also we need to improve their muscle mass. They need to exercise.
Okay.
They need to have a healthy diet. They need to eat right. So just the medication itself will not help them. It has to be a combined
Okay.
effort.
So,
Yeah.
there has to be a synchrony between medicine taking plus
Yeah.
the lifestyle
Yeah,
balancing.
if somebody is having medication but then eating a lot of sugary foods, that is emotional eating, or because of stress they are eating, and then definitely the number of medications are going to go up.
Okay. So, lifestyle really plays a very
Yeah.
important role when we are dealing with any chronic disease, I would say.
Yes, definitely.
Okay. So, doctor, do you think diabetes treatment has evolved significantly compared to earlier times?
Yes, these days we have medications which improve the blood sugar levels, which bring down the HbA1cs, but they also have beneficial effects for a good cardiac and kidney health. So
Okay.
they are having a lot of other benefits also, and they prevent certain complications related to diabetes.
So, what gives you hopes today when you're treating patients with metabolic disorders?
So when the patient listens to you, when he takes the medication correctly and on time, and also follows the advice related to diet and exercise which you give them, and when you see a blood report, when you see their HbA1c is coming down, when you see a good fasting and post lunch blood sugar level,
Okay.
that makes you very happy, and it's a combined effort. Both the patient and you have to work on it together.
Yeah. Let's try to find out the long term complications of diabetes. So, many people actually don't fear diabetes until the complications happen. So, what do you think about people having that kind of awareness on the complexity?
So diabetes has certain very serious complications if not controlled. They can lead to heart diseases, stroke, kidney diseases, and also diseases of the eye, diabetic
Right,
retinopathy
right.
and neuropathy, nerve damage, and it can also cause peripheral vascular disease. So they
Hmm.
can clog the arteries of the limbs of the legs.
Correct.
So these are all very serious complications. So treatment has to be started on time, and also they have to watch out for these complications. So it's very
So,
important to treat it on
okay.
time.
So, these are the complications that occur in long term when a patient is having diabetes, or these get even happen during the early stages?
So it depends when the patient is diagnosed. If patient is diagnosed early on, uh, these complications can be prevented. But
Okay.
if it is patient is diagnosed in the later stage of the disease, they may
Hmm.
already present with those complications, and then it becomes a difficult task to treat that as
Okay.
well.
So, is the heart disease complications directly related to metabolic health?
Yes, so as we discussed earlier, the visceral fat, the abdominal fat, and overall increased body fat leads to high blood sugar levels, high cholesterol, high blood pressure. All these lead to heart diseases. So, good metabolic health is very important for having a good cardiac health.
So, why is prevention easier than treatment in these kind of cases.
So as we know, prevention is better than
Than
cure.
cure. Yeah.
So once they develop heart diseases, they will need intervention. They'll need multiple
Hmm.
medications. Uh, Plus, it's always better to prevent from having any of these diseases. So
Okay.
good metabolic health, having blood sugar levels in the normal range,
Hmm.
being fit, is definitely going to help in the long run.
Longer. Okay. So, doctor, how does a platform like One Health Assist help you in your daily functioning?
So it helps me by having a digitalized, prescriptions, having records of my patients. Also, it reminds me about the appointments that are scheduled, and the billing process is also digitalized. So entire clinic management with just the help of one app, you can use it, and it's very user friendly as well. So it's helping me in my practice.
Okay, that
Yeah.
is really great to know, doctor. So, since we just discussed about how this platform of One Health Assist is helping you as a doctor, if you can give us an insight of how your patients are benefiting.
So there are a lot of things for the patients also, like there is pill tracking, calorie tracking, fitness. You can track your fitness levels. Uh, then it also reminds them about their appointments, so they get a reminder about when their next appointment is scheduled. So there are a lot of benefits, a lot of things which will help them have a good health,
Okay.
and everything is all their medical problems and all their concerns can be dealt better under this just one app.
Yeah, that's really great to know. This brings us to the end of the podcast. Thank you, Dr. Soumya, for your great insights on the current trends on diabetes and obesity. It has given us a lot of information that was lacking, and it was really great interacting with you on the show. So, thank you, Doctor.
Yeah, thank you so much. Even I had a good time, and I think it's very important for people also to be more aware about the things that we discussed.
Correct. Yeah. So, please stay tuned. Please like, share, and subscribe, and take care of your health. Thank you.